Spence, I want to address this question to you, and this came from Sue Lynn Ledford. It's in reference to health care. In the general election, health care will be a prominent issue which the public will want to address. How do you propose to put forth a compassionate and economically sound plan for health care services on the national level?
By following the advice of professionals who understand the complexity of the healthcare system and why it's broken. And the first priority that I've been told from those folks is eliminate frivolous lawsuits. I think that's good advice, but there are a lot of other things that need to be done as well. We need to reprioritize and reorder our national healthcare system on the basis of prevention. And all Americans should be encouraged to lead a healthy lifestyle, to reduce the cost that all of us place on the healthcare system. We need to look at portability. We need to look at a system where we buy our own healthcare policies as individuals and not through companies. And if that's not possible, we need to look at consortiums which would give small businesses the ability to pool their resources to buy healthcare policies for their employees, something that I couldn't do as a small insurance agency owner. There was no way that I could afford any health care for anybody that worked for me, short of bankrupting the business the very day I took those policies out. This is a serious issue that's draining the national economy. It's making us less healthy than we should be as a nation. And if we deal with it in the way that I began to outline, we can turn the healthcare system into something that will care for all Americans without being a universal government-driven healthcare system.
I began my career as a trial lawyer, and I know, though I didn't handle medical malpractice myself, I know lawyers who did. And the simple fact is, if 30 cents on the dollar in a large malpractice case is going in to pay the lawyers, that's not buying any Band-Aids. That's not having anybody's appendix taken out. That's a straight waste of money. And I say that as a lawyer. I agree thoroughly with what Spence just said, that we have to squeeze the lawyers, the litigation lawyers, the vultures, some of them are, out of the process to save money. Now, do I believe in government-run health care? No, I do not. I don't think the people who run the Department of Motor Vehicles and the post office should be running health care.
Exactly.
Well, it is a joke, but jokes are based on truth. We have an excellent healthcare system. Nobody dies on the steps of an American hospital because they didn't have insurance. Whereas in other countries, if they can't pay, they die right there on the steps. So there are ways to get better healthcare for the dollars we're now spending, some of which are wasted.
I don't believe in big government. I don't believe the government should be in charge of our health care. Starting place would be tax breaks so that we can buy our own policies. Deregulation. I don't believe attorneys are the big problem in health care. I believe the problem is we have a hybrid system of socialized medicine and free enterprise medicine that doesn't work. I can promise you that as a congressman, as your congressman, I will not accept health care when I get there. I don't think we should be living better than the people we're serving until we fix this problem for everybody, not just for us and a few select folks who can afford to. I caught you that time. For a few select folks who can afford the benefits of what is one of the best healthcare systems, if not the best, in the world. The problem is too many people fall through the cracks.
Let's take on the issue of illegal aliens in this country and see what proposals we may have. No, I'm not going to talk to you this time, Colonel. It's going to be someone else. John, what approach would you take to the issue of illegal immigrants in this country, which are generally acknowledged to be at least 12 to 20 million?
It's probably higher than 20 million. And as I mentioned before, our schools, our hospitals, our welfare systems, our prisons are all overrun with people who are not Americans, and yet American taxpayers are paying for all of that. Plus the fact, more Americans, men, women, and children, are being killed in the United States by aliens, people from other countries, that are being killed in all the wars we're fighting anywhere in the world today. I'll repeat that. More civilians, men, women, and children are being killed, especially on the highways, by illegal aliens in the United States than our soldiers are being killed in the wars we're fighting. That has to stop. We should obey the laws which have already been passed. 5 years ago, Congress passed a law to build a fence. Not a Berlin Wall, but a fence. And it so happens, contrary to what Carl Montgomery says, that it works. There are miles of it in San Diego that have dropped the illegal immigration by 90%. That ain't perfect, but it's a whole lot better than what we've got in Arizona, New Mexico, Texas, and even places like Florida. And by the way, the state with the fastest growing illegal immigration numbers, guess what? It's North Carolina. We don't have the most of them, but we have the fastest input of them coming in, and also the fastest rate of dying on the highways, the filling up of the prisons, the filling up of the schools, et cetera, et cetera, et cetera. So that's a law to build that fence, passed 5 years ago. Do it. Secondly, there are laws on the books that make it illegal for employers to knowingly hire illegal aliens. Are they enforced at the federal level? Not on your tin type. But in Arizona, they passed a similar law. It says the same as the federal law. But guess what? They're enforcing it. And what's happening? Illegal aliens are self-deporting from Arizona. Some are going back to Mexico, but some are coming to other states where the laws are more lax, including North Carolina. That's why we need an effective federal law. We don't need new laws. We need the enforcement of the laws we've got. And they would work, and they have worked where they've been applied.
Have you noticed that the government sometimes responds when Americans like us ratchet up the pressure? We've never really done that about the border between Mexico and America until recently. That's why it's always been an open border. And we talk a lot about Hispanics and illegal aliens coming through there, but there could be terrorists coming through there as well. It's time to deal with this issue, and I think it's not a good analogy to talk about the Berlin Wall. I was stationed in Berlin for 4 years, and I lived by the wall. It was 20 feet high, had parapets, mines, automatic weapons, those kinds of things. Not a good deal. This situation is build a fence, enforce the laws, and support the ICE program where local sheriffs can begin deportation programs for alien criminals, and then we'll go from there and fix it in the Congress after President McCain takes office.
The reason they had the Berlin Wall is that's the only thing that would work. You had to put mines and 20-foot walls and sniper towers. You can go to your garage and in 30 minutes defeat any fence, any design fence that or any fence that has been designed so far down on our border. Now there are places that they work well, but the solution to our illegal immigration problem is not going to be found on the border. It's going to be found right here in Western North Carolina and all over the country, where we uphold our existing laws. And you have to go after the bait. And what's the bait? The jobs and the money. And one of the things I find reprehensible is our willingness to sacrifice the next generation of Americans. We have a 30% dropout rate. There's no incentive on our part, on the business community's part, to do anything about that, because we've got this cheap, easy access labor pool. We're losing a generation of Americans to illegal immigration. That's wrong.